Now, numbers of COVID-19 cases in Washington prisons continue to rise. So far, 4 inmates and 1 staff member have died. Today, I spoke with a Kennewick father whose son is in the Washington State Penitentiary. He says the pandemic is making prison an even harder place to be.
He told me he was in solitary confinement, and I was like, what?
David Detloff was shocked to learn his son Noah, serving time for drug possession charges, had been put in solitary confinement at the Washington State Penitentiary.
They said that was their way of intake to protect from the spread of COVID.
The father says he was worried sick about Noah's well-being.
For the first 10 days, he was not given nothing. No phone calls. There was nothing to read.
Noah isn't the only one. Loretta Peterson with the Washington Statewide Family Council, which advocates for the families who have loved ones behind bars, says many families are hearing a similar story.
I'm really worried about prisoner physical and mental health in these really isolated, quarantine settings. Families are scared about their loved ones getting COVID, but we're also afraid of other ways it's affecting our loved ones' lives.
During a virtual press conference on Monday, statewide advocates discussed the issues going on throughout state prisons. Recent numbers show Airway Heights has 792 confirmed cases of COVID-19, with hundreds more cases at the Washington Correction Center, the State Penitentiary, and Coyote Ridge Correction Center.
People are confined in crowded cells for nearly 24 hours per day. These facilities remain COVID hotbeds or less than humane treatment.
The cell was filthy with no working overhead light.
As for Noah, David says he will continue to advocate for his son. Peterson encourages families with incarcerated loved ones to get in touch with the statewide group online. Now, Cap KVU did reach out to the DOC, who says, in short, people in medical isolation are allowed each day for 30 minutes. They say they take the health and safety of incarcerated individuals very seriously, and medical isolation is not a punitive measure.